they go. I want to thank Representative Raja Krishnamoorthi for gathering us here today, and I'd also like to recognize the senior senator from Illinois, Dick Durbin, Representative Jan Schakowsky, Representative Robin Kelly, Representative Brad Schneider, Representative-elect Sean Casten, Representative-elect Lauren Underwood, Commissioners Donna Miller, Kevin Morrison, and Bill Lowry. And from the staff of our Health and Hospital System, Dr. Claudia Fegan, who's our Chief Medical Officer. I'm grateful for the hard work that all of you have done to preserve health care for our residents and for your support of Cook County Health. Dr. Jay Shannon and I go to Washington several times a year to meet with our congressional delegation, and frequently the focus is on our healthcare system. We've met many times to highlight the importance of the Affordable Care Act, and we will continue to do so because the ACA has been critical to the residents of Cook County. It's unconscionable, but at this point, not shocking, to know that a Republican-led Congress, enabled by the President, would slash the ACA's marketing budget so the public isn't adequately informed of tomorrow's ACA deadline. It's unconscionable, but again, not shocking, to see a Republican-led Congress, enabled by the President, attempting to chip away and undermine the entire law at the expense of millions who depend on it. But while there may be attempts to undermine the law, we're proudly standing here today to amplify the importance of the ACA and remind the public of its deadline. Unless you qualify for a special enrollment period, tomorrow is the deadline to sign up for the Affordable Care Act to get coverage in 2019. Let me say that again. Tomorrow is the deadline to sign up for the Affordable Care Act to get 2019 coverage. If the ACA is dismantled or gutted, our county and our residents will suffer. So I'm grateful to our members of Congress, those here today and those who stand united against this perverse effort to undermine the ACA. We must fight on. We must do what we can to support the efforts of these members of Congress who support us, and we will. Thank you. Now I'd like to turn the podium over to Congressman Raja Krishnamoorthi.
Actually, I'd like to turn it over to our senior senator, Dick Durbin, first.
Actually, I'd like to turn... Thanks, Raja, for calling us together. Toni Preckwinkle, as president of the Cook County Board, came to Washington when Barack Obama was president and asked if we in the delegation, Jan and Brad and all of us, would join her in creating County Cares. The net result was 120,000 residents of Cook County were given an opportunity to have health insurance, many of them for the first time in their lives, 120,000. With the passage of the Affordable Care Act, half of the uninsured people in our state, half of them, ended up getting insurance sometimes for the first time in their lives. Now, tomorrow is a deadline for those who need to sign up again. There are roughly 350,000 across the state of Illinois who have participated in the insurance exchanges, and it isn't a matter of take it or leave it. There are 5 different insurance companies that you can choose from. And the good news is the increase in premiums this year is marginal. It's in the 4 to 6% range. And 80% of those who apply tomorrow will qualify for help in paying their monthly premiums. You may end up paying $50 a month, $100 a month to have good health insurance coverage for you and your family. Mr. Lowry, would you hand me that sign over there that's right behind you? This is what it's all about. We've got to make sure that people across Illinois and Cook County realize that they have about 36 hours to make sure they're signed up. And if you don't know where to turn, here's the basic information that you want to turn to and make sure that you are covered. There's nothing worse, as we learned in this last election, and people are worried about the notion of having no health insurance, particularly if someone in your family has a medical history, a pre-existing condition. Don't make a gap in coverage. Step up and make sure that you're insured. And now I'll turn this over to Raja to turn it over to someone else.
Good morning.
Good morning. Good morning.
Thank you, Senator Durbin. As some of you may know, my wife is an anesthesiologist. The joke is that we both put people to sleep. And so I'll try to avoid that. I just have 3 quick points I want to make. Tomorrow, December 15th at midnight, that's tomorrow, December 15th at midnight is the deadline for open enrollment. The way you get coverage is simple. It's through getcoveredillinois.gov. That's getcoveredillinois.gov. Second point, the reason why all of us are here today is unfortunately not enough people have gotten the message. We have seen that enrollment is down by almost 12% as compared to last year, and the reasons are simple. The Trump administration has reduced funding for advertising by 90%. The Trump administration has reduced funding for the Navigator outreach program across the country by 70%. And the net result is that the uninsured rate for the first time in several years has gone up. The uninsured rate went up in 2017, and it may go up again if people don't go to getcoveredillinois.gov to get coverage. Now, given what Republicans are doing to the Affordable Care Act, and given the recent elections in which people emphatically said that we should strengthen health care, not tear it down, I've come to conclude that President Trump and Republicans are afflicted by a certain pre-existing condition. It's called amnesia. So let me remind them about what the Affordable Care Act has done for America. The Affordable Care Act has increased coverage for 17 million Americans, making sure that they can afford to pay for their chronic illnesses and their preventive services and avoid bankruptcy through one medical bill. The Affordable Care Act has also provided incredible protections for the rest of Americans who already have insurance. People under the age of 26 can join their parents' plans. There's no lifetime caps anymore. And most importantly, there are protections for 130 million Americans with pre-existing conditions. In summary, to anyone who's eligible, again, tomorrow, December 15th at midnight is the deadline for open enrollment, so please go to getcoveredillinois.gov. And to President Trump and each Republican, your amnesia is treatable. And you should talk to your constituents about a cure that's right for you. Either join us Democrats in strengthening health care, not tearing it down, or face your fate in the 2020 elections. And unfortunately, your prognosis might be dire. Thank you again. The next speaker is Jan Schakowsky. Thank you.
I want to thank all the media that is here because getting this message out is absolutely key. I hope you'll continue to pump it, not just one time, because it is so critical for so many people in our community. So this press conference is for all the procrastinators among us, people who wait to the last minute to make an important decision. This is the last minute. If you do not enroll for an affordable health insurance policy, tomorrow is the deadline at midnight, you will not be eligible. It's important to understand that affordable health insurance is available to you. Over 80% of the people last year got subsidies that helped them pay for their insurance. There are more choices than ever this year for you to be able to make. You can call, you can go to the website, you can go to the phone number, you can get assistance. It is available. And finally, I just want to say to people who have had a plan, check it out, because that plan may not be as good for you this year as it was last year. So take the opportunity to find the very best plan. Tomorrow at midnight is the deadline. You can't wait any longer. Thank you.
Next, Congresswoman Robin Kelly.
Thank you, Raja. Thanks for gathering us today, and good morning to all of you. If we sound like an open record, we just want to remind you to get covered. It is so very important, as you've heard over and over and over again. Unfortunately, many people are at risk of not having health insurance in 2019 because they don't know that open enrollment is happening or that the deadline is just around the corner, and that's why we're here. If people miss the deadline, they will have to wait until 2020 to obtain affordable coverage. So ask your friends, ask your family, and let's make sure everyone gets covered. This year, low and moderate income consumers can find good deals for health coverage, and 8 in 10 people using healthcare.gov qualify for financial assistance. As a result, most people can find a health plan for less than $75 per month. Over the past 2 years, we've been in a virtual hand-to-hand combat with the Trump administration and Republican Congress, and we won. We held the line and protected health care coverage for more than 23 million Americans and over 1 million Illinois residents. We won because of grassroots activism by determined people here in Cook County and in Illinois. People who believe in compassion for our neighbor and equality for all, including equality in health care. We won because of the work of dynamic advocacy organizations, many of whom are here and have fought side by side with us to preserve and expand the ACA. But the Trump administration operates like the Terminator when it comes to its determination to destroy the ACA. It just takes up another form and keeps on coming after affordable health care. Some of those tactics include the open enrollment period shortening from 90 to 45 days and slashing funding by 90% to grassroots groups that help people sign up for the ACA. They are hoping that people will miss the enrollment period, resulting in fewer sign-ups, and the ACA dies a slow death. They are playing games with people's health care, and that's just plain wrong. So we have to push back. We have to educate ourselves, our family, and our communities about open enrollment, and we need to help everyone sign up so they are covered. In November, the American people gave Congress a clear mandate: protect, improve, and expand the ACA. In the next Congress, we will work actively to reduce health disparities and ensure that all Americans have access to affordable, high-quality health care, regardless of race, ethnicity, or the ability to pay. But today, we need you to sign up and get covered before midnight, so on Saturday. So get covered.illinois.gov before it's too late. Thank you. And now I'd like to introduce
Brad Schneider.
Brad Schneider.
Thank you and good morning. There's a saying in politics that everything has been said, but not everyone has said it. And this is one of those moments. But it's important because this is one of those moments we need people to hear the message. I want to first thank the press for being here to help us get this message out because it is so important. I want to thank my colleague Krishnamoorthi for organizing us and pulling us together, Senator Durbin for your long leadership on this issue, President Preckwinkle for what she's done to make sure county cares came to reality. And today is the last moment for this year. To get coverage for 2019, it's imperative that people go to getcovered.illinois.gov, go online, make the phone call the number, and get your insurance before midnight tomorrow. And as has been said over and over, it's important to note that 4 out of 5 people getting insurance on the marketplace qualify for help with their premiums. There is no reason not to have the coverage. And I know far too well, talking to far too many people, that those who don't have coverage, who say, well, we'll try to go a year, can face dire consequences. Please, please get your insurance. I know that in the coming Congress, the people standing here are going to come together and work to fight to improve health care in this country, to protect the Affordable Care Act, to build on its strengths and successes, and to work to find more ways to ensure that more people can have insurance. Because in this great country, no one should be without insurance. Today, no one has to go without insurance if they'll just go online, pick up the phone, and get covered before midnight tomorrow. Thank you.
Thank you, Brad. Next, our member-elect Sean Casten.
Thank you, Raja, so much for organizing this. Thank you for all of the existing members of the Senate and the House for creating the ACA, and those of us in Cook County who have made this program the success it is. I want to reiterate the thanks to the media. An awful lot depends on you guys promoting this message right now. All of us in this incoming class, we needed 23 seats to flip. We all campaigned on health care. We flipped 40 seats, maybe 41 by the time North Carolina's done. The American people have spoken very loudly that they support protecting and extending the ACA. The administration does not share that view right now. And when they cut marketing by 90%, we're all depending on you all to tell this story. So please make sure that everybody hears this message. You know, I want to speak as an employer, former employer. Those of you who are watching this, who have participated in the ACA before, you probably know what this process looks like. You go, you get enrolled, and please continue to do it. Those of you who may have lost a job recently, may not be familiar, all that this process is that process you had in your office before. Someone from HR kept coming down and knocking on your door and saying, hey, the open enrollment period's ending, you need to sign up, you need to get in there. You don't have the benefit of that person in HR talking to you anymore. You should have the benefit of the federal government telling you, and because of the Trump cuts, you don't. So please, make sure you sign up. This program works, it's successful, as folks have said. There's about 30,000 people in the 6th District in Illinois that depend on the ACA. There's over 300,000 with pre-existing conditions who are one job loss away from depending on the ACA. So please participate. It's a good program, it works, and let's make sure that people are aware of the deadline. As Senator Durbin said, 36 hours away. Thank you very much.
Thank you, Sean. And our next member-elect, Lauren Underwood.
Good morning, everyone. Thank you. I'm so proud to stand here with my esteemed colleagues. Let me tell you, not only as a registered nurse, but as an individual with a pre-existing heart condition, I know firsthand how vital access to health care is for me personally and for all of our friends, families, and neighbors here in our state. Sadly, even today, 24 hours before the deadline for enrollment, we know there are still far too many Illinoisans who are not registered who need to understand all of the preventative benefits and options available. For so many of our neighbors, the Affordable Care Act has been able to afford life-saving medication and treatment, and that is the value of being covered. In a state that expanded Medicaid under the Affordable Care Act, we must continue to fight to ensure that all Illinoisans are taking full advantage of the progress that we have made. I spent my career working to expand health care coverage and will continue to spend my congressional career fighting to preserve this right for my constituents and for the American people. Access to health care is a fundamental right, and we are here to ensure that our state is taking full advantage. Now, I am an American that has coverage on the marketplace, and I have waited till the very last moment of the open enrollment period to sign up, and I am urging everyone to take advantage of this opportunity, particularly the young people who are listening to this message. Healthcare is not something to gamble with, and we need to take advantage of the opportunity to get covered right now. Thank you.
Lauren, definitely please sign up right away. And then finally, Dr. Claudia Fagan of the Cook County Health System. Could you please say a few words?
Thank you. I'm very proud to be here as a county doc. And as a primary care physician, I can tell you I understand the importance of not just providing coverage, but continuity of care. 2 weeks ago, I saw a patient in my office who I hadn't seen since March. And then when I saw her in March, she had just lost her husband. So I asked her what happened, where she had been, and why she hadn't been in to see me. And she explained after she lost her husband, she lost her insurance. And so she had to, for the first time, with all the things that were coming at her, try to figure out insurance. And she'd never had to purchase insurance before. So she purchased a policy, and she had gotten a card, and now she was happy she came back. She said, now I can see you. And I didn't take the time to remind her that we would have seen her regardless, because we're proud in Cook County that we take care of people regardless of their ability to pay. But I looked at the policy she brought me and the card that they had issued. And it was an accident and sickness hospital indemnity insurance policy. It said the plan provides financial peace of mind and protection. So it provided no coverage for her visit. It said in the policy, in the paperwork that they brought to her, sent to her, it said that this policy does not meet the minimal essential benefits as required by the ACA. She had no grasp of what this policy was. She just thought insurance was insurance. And when I told her that this was not a health insurance policy, she wept. But I explained to her, I was happy that we had a financial conflict that would help her. We told her we would help her and not to worry. We would get her enrolled properly. that there would be no problem with her bill for that day, and that we would always take care of her. But it's a devastating thing for patients to try to figure out how they get coverage. It's a complex system, and they don't understand. Get Covered Illinois helps patients get enrolled and get coverage. And I have to tell you that for this to be a barrier to care is costing lives every day in this country. And I have optimism with the Congress that we have elected that we will finally begin to acknowledge that health care in the United States should be a right and not a privilege. Hoping for the day for universal health care, but in the meantime, we at Cook County Health and Hospital System are quite proud of all the patients who provide care to on a daily basis and the lives we save. Thank you.